Hello.
Hello.
Go ahead and introduce yourself and then share with us some of the things that you were dealing with prior to becoming a patient.
Okay, I'm Susan Doyle, and I was 56 years old when I came here for the first time, recommended by a friend, looking specifically for a chiropractor. I, at that time, was close to, about sneaking up on 300 pounds, and I was on 9 medications, had sleep issues, low back pain, especially the right side, hip pain. I had a knee problem, knee pain that I'd had for 30 years at that time, by that time. The low back pain was a good 20, 25 years. Diabetic and sleep disturbances, anxiety and depression. This was my main list. And fibromyalgia.
Okay.
And I came in, my goals were to, high blood pressure. My goals were to have reduced blood sugar, working toward remission of diabetes, and not have high blood pressure, to have a more normal weight, maintain a normal weight, and to not have these chronic pains.
Yeah.
I didn't even think about the sleep, anxiety, or depression. Didn't even really mention them when I first came in.
Okay. And you've been under care for
4 years.
Couple years, right?
Yeah.
4 years. Share with us how you're doing now.
Well, first I'd like to say I marked in my medical journal, which I have, recommend one for anyone over 50. But anyway, at about the 8-month mark, and many of these things happen quicker, but by 8 months I could say that it had been 6 months since I'd taken any anxiety medication, which surprised me. In fact, I just forgot about them because they were as needed. And to me, as needed was every day, sometimes twice a day.
Yeah.
Then I started forgetting to take them, and then I forgot I needed them until my appointment with my doctor, my twice annual appointment came up. I was like, oh. And then I had fewer and fewer depressive episodes. The knee pain went away in 3 months. It was completely gone after 30 years. I had a lift in my shoe when I came here first, and that went away. I no longer needed the lift. My legs were not different lengths, and the low back pain started to go away as well. By 8 months, no knee pain, no low back pain of any substantive measure, and I noticed also I was down to maybe 1 time a week using a sleep aid, as opposed to 6.
Wow.
So let's just say, to clear any hurdles, by 2 years, I eliminated 4 psych medications. I completely have not needed them, and I have never needed them again. I do not need sleep aids. I do not have pain in my left knee, which I injured when I was 21 and had pain until I was 56, which I don't have anymore. I was told it would just always be there. There's nothing I could do. I had cold laser therapy, and since then the fibromyalgia pain is something I don't think about anymore. It's like, oh, do I still have that? And I can do a 16-hour day with no problem. I can walk 10, 15,000 steps if I need to.
That's terrific.
I am, so I am currently, and due to other interventions, but mostly my cardiologist says because of the weight loss, because of the increased activity, I went from 3 to 1 blood pressure medication, and he said after maybe a little more weight loss, it's very close now, he'll take me off of that one too, and I will be on 0 pharmaceuticals after being on 9.
That's huge.
Just 4.5 years ago. So not only is it huge, it makes me want to cry. And the expense and the side effects and who knows what else, and I don't have to take those in. And the pill keepers, which was a ritual. And
yeah.
I don't have anything to talk about at parties with my friends.
So, what would you say to someone who's contemplating upper cervical care for themselves?
I would say that You must try it. I would say give it 3 months before you even make a judgment. It is totally, well, I've also brought my partner in and my daughter, and they have also had life-changing results. And it's just good, solid science, and it's a part of the science of medicine and the art of healing are all mixed into one there, and it works. So I went from crawling to flying. I was literally crawling upstairs.
Yeah.
And now I run. I can run. I couldn't run. I haven't been able to run since I was about 35 years old, and I can run. I'm just like completely astonished.
You mentioned fibromyalgia and sort of that chronic fatigue syndrome issues. What would you say specifically to someone who's dealing with those two?
That there is an other side to that. I was diagnosed with fibromyalgia and the chronic fatigue the year it was named, which was 1982.
Okay.
And I suffered with that until, I'd say, 3 years ago. So what would that be? 2016.
So 1 year.
How many years is that?
Yeah.
34 years.
So 1 year into care here.
Oh, yeah.
Gone.
The fatigue, for sure. I was doing 16-hour days.
Yeah.
And not having issues. And over time I've learned to have a better ergonomic setting, to respect my spine, respect my body, and I've made changes that just reinforces the healing and keeps me on this upward trajectory.
That's awesome. Cool. Well, thank you so much for sharing. I appreciate it.
You're very welcome. Thank you.